This is Jessica Briscoe, and this is my online mini-teach on instrument sharpening. Think back to any job you've done in the past, whether it be seeing patients here in the hygiene clinic, working in an ice cream shop in high school, or working in a factory. I want you to reflect on those experiences and remember and describe failures you experienced in that job when you didn't have the right tools for the job and or successes you had in that job when you did have the right tools for the job. I have had a lot of experience as a substitute hygienist in several different dental offices over the years. As a rule, I'm already unfamiliar with the office and the equipment, so I'm already working a little slower. When the instruments they provide me are dull, I can't work as efficiently, so it doesn't prove to be the best experience possible. When I sub at an office with sharp instruments, however, I can scale accurately and efficiently, and it makes the day go much smoother. Having the right tools for the job can make all the difference. Let's watch this dentist and his choice of tools.
Let's see how it looks in here. All right. Okay. Nice. You have very nice teeth. Oh, one small cavity, no problem. We'll get that taken care of in a jiffy. All right?
Great.
Okay, open up wide. There you go. Okay. Have you been on vacation lately?
Yeah.
Where'd you go?
Uh-huh.
Mexico. Wow. Where'd you stay?
Uh-huh.
Really? You okay?
Uh-huh.
All right. Just 1 second now.
Uh-huh.
All right? Open wide. How about this weather we're having?
In 1956, psychologist Dr. Benjamin Bloom created a system to promote higher order thinking rather than rote learning. After a learning episode, the learner should have acquired a new skill, knowledge, or attitude. You may have seen this quote before. I believe it's applicable to many areas of study and to many learners, especially a student of dental hygiene. In this hands-on lesson on instrument sharpening, we will move through the hierarchy of Bloom's taxonomy for the cognitive, psychomotor, and affective domains. If you'll remember, the cognitive domain deals with facts and knowledge, the psychomotor domain deals with physical skills, and the affective domain deals with emotions and attitudes. The first objective for this lesson that pertains to the lower levels of the cognitive domain is that after being shown what different types of dental hygiene instruments look like, you will be able to identify each different type of instrument correctly every time. Pertaining to the higher levels of the pyramid, after being taught about the cutting edges of each of the dental hygiene instruments, you will be able to assess when an instrument needs to be sharpened and demonstrate the correct angle at which to sharpen each instrument every time you hold the instrument to the sharpening stone. On the lower level of the psychomotor domain, after being shown how to correctly sharpen an instrument, you will be able to reproduce the correct sharpening technique and test with a plastic test stick 50% of the time. As your skill level increases, you will be able to sharpen each instrument correctly and evaluate the sharpness using a plastic test stick 95% of the time. Within the affective domain, after listening to instructions on how to sharpen and the reasons why it's best to maintain sharp instruments, you will be able to state at least 2 benefits to maintaining sharp instruments in clinical practice. After exemplifying the appreciation for sharp instruments, you will routinely sharpen your instruments by creating your own sharpening schedule. The supplies we will need for this lesson are dental hygiene instruments or scalers, Now, these were some new instruments I received from my boss all at once, so obviously they didn't need to be sharpened yet. It was like Christmas for a hygienist. We'll need sharpening stones. My personal favorite is a ceramic stone, which I have used the entire 20 years since I graduated with my associates in dental hygiene. I have tried other stones and even a sharpening machine, and in my opinion, the ceramic stone offers the quickest, most reliable, and least messy results. You use it dry versus using oil, and then put it in the ultrasonic to remove the metal shavings. It does not become grooved and produce a sludge like other stones. If you maintain sharpness and shape with regular sharpening, then you don't need to recontour with a coarse stone. This is my sharpening stone. It had some adhesive from the autoclave bag stuck on the surface, and once I started sharpening, it turned into an image of a woman. You have to have some fun in your job sometimes. You'll also need test sticks, gloves, and a clean flat surface. As you can see in this image, design variations of dental hygiene instruments include sickle scalers, universal curettes, and Gracie curettes. You need to first be able to identify the different types of instruments and be familiar with the functional shank, terminal shank, and the working end. Sickle scalers and universal curettes have a blade with a 90-degree angle. Gracie curettes have a blade with a 70-degree angle. The instrument we will practice sharpening in this lesson is the Barnhart 5.6 Universal Curette. We will refer to the steps in the Hugh Freedy video, It's About Time Sharpening. Imagining a clock face as a guide and using your non-dominant hand, position the instrument vertically with the blade to be sharpened at the bottom. Stabilize the entire length of the instrument with a firm grasp. Brace the upper terminal shank with your thumb to counterbalance the pressure of grinding the blade at the bottom. Point the tip or toe of the blade toward you to sharpen the cutting edge. Keep the terminal shank at 12 o'clock. Place the surface of the stone against the lateral surface of the blade. Tilt the top of the stone to 3 minutes past 12 o'clock if you're right-handed. For left-handed clinicians, tilt the stone to 3 minutes before 12 o'clock. Using continuous up and down motions, move along the blade starting at the heel third, middle third, and finally the toe third. To round the toe of the curette, direct the toe towards 3 o'clock. Place the stone under the blade at 2 o'clock. Use continuous overlapping up and down motions to round the toe. Check the sharpness with a plastic test stick. When we maintain sharp instruments, we are able to remove calculus more thoroughly, leaving less burnished deposits. Sharp instruments reduce hand fatigue because we don't have to use as much lateral pressure or force or as many strokes, and improve our tactile sensitivity, thereby protecting the longevity of our career. Sharp instruments reduce patient discomfort by allowing us to remove calculus more efficiently, which also helps us manage our chair time. Finally, sharp instruments just work better. We've all invested a lot of time and money in our education and our instruments. We need to protect that investment by maintaining our instruments through correct sharpening techniques. We all aspire to be great hygienists. Maintaining sharp instruments is one very important way to ensure we have a long, rewarding career of improving our patients' health and well-being. To be effective and efficient at removing calculus, we must practice with sharp instruments. Dull instruments require us to use more force and time and can lead to insufficient removal of calculus or burnished calculus. It's important for you to be a willing participant in your learning new information and skills to be successful in your career. I invite you to create a routine schedule for sharpening instruments in your clinical practice.